my name is Dr. Barbara Rodwin, and I'm a doctor of chiropractic from the Bactive Health Wellness Center in Ottawa, Ontario. And I want to talk to you today about something known as patellofemoral syndrome. So that essentially means discomfort at the front part of your knee through this region here. So it's actually usually when patients come in, they're having discomfort and they'll say it's like a vague type stiffness, or sometimes they feel as if it's swelling. You don't see swelling, it's actually just as a result of it getting tight and sore. And that type of patellofemoral syndrome, because patella stands for kneecap, and the kneecap is the little bone that sits on the front. Femoral means femur, so it's actually this long bone here. And patellofemoral actually means the way that the patella is in line with the femur. The patella is supposed to sit, so the kneecap sits inside this tendon, and this tendon comes from the quadricep muscles. Those are all these muscles up through here, and quadricep means four, so it's four different muscle groups that come down and attach into this tendon, and then the tendon attaches to a bone. You have a little bump down on your shin there where the tendon actually ends. So with respect to the patella, it normally sits in behind that tendon in a groove. There's a little groove on the femur, as it's known, and the groove, when your knee bends, so when it bends up and down, so when you're going like this, the patella actually moves up and down as you're going upstairs, downstairs, or if I go to get up from a seated position, it's actually moving. Sometimes with some people, and it can be due to different reasons, which I'll get into later, this kneecap, instead of sitting properly in the center part of the groove, so how I explain it to patients sometimes is it needs to sit in such as this, and then what happens is it rotates over to the side. So then as you're bending your knee to walk, to run, to bike, to go up and down stairs, to squat down, to get into a cupboard, or to weed, then it's actually off to the side and it keeps rubbing the side of one of the bones. So that's actually patellofemoral syndrome, meaning a misalignment of this kneecap. Now the kneecap can be misaligned for a number of reasons. One is if you actually have a rotation through your hip or some unleveling. So sometimes if your hips are not even due to a curve in your back or due to other different reasons, maybe you have a hip issue and there's a rotation through your hip, it will cause a change in the movement of this hip. It might rise the leg up and then it can change the alignment of the kneecap. The other reason why the kneecap can get misaligned is as a result of injuries to the knee due to sports. Maybe you're overtraining or doing different things that you shouldn't be doing. And the other reason, that one of the main reasons often, is the foot. The foot has three arches in it, and they're supposed to be up like this. Now if your foot flattens out, and that flattens out even in just one of the three arches, it actually causes a rotation of your knee, which would rotate these two bones. And when those rotate, they can cause the kneecap to rotate as well. So this whole area can then be out of alignment with respect to things. So it is something I treat all the time. Different things that you can do for it is, one is using a knee brace. This knee brace has a little horseshoe inside. The horseshoe faces down, and what that allows is when you put your kneecap inside this, then it actually holds it in alignment. It can help actually keep it there and retrain it that way. Some people think of braces as casts. It's not going to weaken anything. So you could wear it 24 hours a day, 7 days a week, for a whole year, take it off, and it's not weakened. It's just helped stabilize it and retrain it. I'm not saying you should wear it all the time, but some people do wear it often, especially when they know they're going to be doing things that can aggravate it. The other thing you can do to actually help with it, these are boxes or AccuBalls. So an AccuBall are these, and you can use it on your knee to help release different parts of it. We do have videos on our website showing you how to use these, so maybe watch one of them. The other thing you can do is use a foam roller. to actually roll it. We do have an excellent video as well on our website and on our YouTube channel on foam rolling, and it shows you how to foam roll your knee and other parts of your leg, your hamstrings and your hip, because you usually have to do the whole thing even down into your shin. So those are at home things. Another major one that actually helps is icing. If you wrap an ice pack on with a tensor bandage, don't do skin contact, but do ice it. And you leave it on for 20 minutes at a time, and it can help quite a bit. Even if it's just stiff, there doesn't have to be swelling. People think there has to be swelling. If you come in from weeding and it feels stiff and sore, put an ice pack on, and it helps it so much. Now, things that we do in the clinic for it, one is active release. Active release is based on the premise that different types of tissues, such as this tendon or different muscle groups or the cartilage or ligaments, tighten up around here and shorten, and we can actively help release those. And another thing that I do as a chiropractor, because people don't think of me as treating knees, but I do treat knees, where I can actually adjust this kneecap or these two bones if they shifted, and you can adjust them to put them back into alignment. So one of the ways that I do that is using this drop piece. And I put your leg on top of it, just like this, and then I actually raise the drop up, hold the kneecap the way I need to in order to adjust it, and then drop that down. It's not painful, it's just a little noisy with it. I can also adjust it by holding it and adjusting it. And one of the other things we have to do usually with the knee when you have an issue is check the hip to see if it needs some adjustments or active release, and as well check the foot, because the foot does go out of alignment. You can see these two long bones come down into the ankle, so if there is a rotation, it will actually rotate your ankle joint out of alignment too and stress things, and it does need to be adjusted. So those are all different things that we do for patellofemoral syndrome at Back to Health Wellness Center. One other thing before I sign off for today would be actually acupuncture too, because I am certified in acupuncture. So feel free to check us out if you're here, or reach out to me if you're wondering about what to do for your knee pain.